This portion of the news is brought to you by Inspiration Senior Living, where we provide affordable elegance to Pahrump area seniors. Give us a call at 751-2300 and make an appointment to tour our community.
The most common operation done worldwide is a cesarean or a C-section. In order to see better health outcomes, in the mid-1980s, the World Health Organization recommended that member countries' C-section rate shouldn't exceed 10 to 15%. A new study evaluated the relationship between current cesarean section rates around the world and key health outcome for mothers and babies.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
Chances are the mothers of many of these babies underwent a cesarean or C-section birth.
Almost 1 out of every 5 births on the planet occur via cesarean section.
Poorer countries were actually doing more C-sections as a proportion of all the care that they were providing compared to wealthier countries.
Doctors Alex Haynes and George Molina from Ariadne Labs at Brigham and Women's Hospital and co-authors gathered publicly available data from the 194 World Health Organization member countries. Using this information, they estimated 2012 C-section rates worldwide and examined how those rates affected maternal and neonatal health outcomes.
Up to a rate of about 19 C-sections per 100 live births, we see reductions in maternal and neonatal mortality.
Across the world, the average cesarean section rate is over 19%. Going from 19 to 25 to 30% did not result in improvements in neonatal or maternal mortality on a nationwide level. There are many countries where not enough cesarean sections are being performed, meaning there's inadequate access to safe and timely emergency obstetric care. And conversely, that there are some countries where probably more cesarean sections are being performed than yield health benefits.
The authors cautioned that these findings do not apply to any individual patients, facilities, or hospitals.
Our research could give some guidance for why countries should make their healthcare systems stronger so that they can provide safe, reliable, and timely C-sections.
Catherine Dolf, The JAMA Report.
This study suggests that the World Health Organization target rates for cesarean section may be too low and need to be re-examined. Thank you, Catherine.
The West Side Road to Death Valley National Park has been reopened since flooding in October. National Park Service road crews worked hard to reopen it in time for the holidays. West Side Road is one of the hundreds of miles of road that were closed after flooding caused the most expensive natural disaster in park history, costing approximately $30 million in damage. Utilities and 3 historic structures at Scotty's Castle were also damaged. To keep up to date with the repair, you can find Death Valley Park on Facebook.
There were approximately 600 people served at the annual community Christmas dinner held at Nye Communities Coalition.
We're having our annual Christmas dinner for the community today, and it's a wonderful turnout. We're having lots of people, lots of veterans today, and a lot of volunteers.
I think even more actually are seated today than Thanksgiving, right?
Yes, more seated today, and we've done almost 400 deliveries today. So
that's about what you did for Thanksgiving, right?
We did about that.
And so how many do you think were served here inside Nye Communities Coalition?
That I'm not sure at this point, because they're still coming in.
So this went on from what time to what time today?
Well, we started deliveries at 10, and we opened the doors at 12. So it's still going on.
Yeah, and I see Pastor Ron Fairbairn's up there.
Yes, he's our MC for today, and he's doing a wonderful job.
Santa's here.
Santa's here, and Mrs. Claus, and they're giving out gifts to the kids that are in attendance. And we've had Johnny V singing Elvis songs today, and we also have Nick Giordano on the saxophone today.
So the Holiday Task Force puts on meals 3 times a year, and that being Easter, Christmas, and Thanksgiving. So I'm assuming Easter's the next?
Easter's next, and we're looking forward to that, and it'll be a picnic in the park.
What park?
It'll be at Eden Deutsch.
And that'll be on Easter Day, right?
No, it's the Saturday before Easter.
And then are you looking for volunteers, donations?
Donations.
All right, so how can people do that?
they can contact the Holiday Task Force here at the Coalition.
And what's the number? 727-9970.
Yes.
All right. Thank you so much. Anything you want to say to the community?
I just want to wish everyone in Pahrump a very Merry Christmas and a Happy New Year.
That was a lot of fun. It's been a phenomenon for many years. News 46 stopped by a lone cactus off Highway 160 to see if there was a clue near the plant as to who decorates it every year during the holidays. The Christmas cactus that sits on the side of Highway 160 near the northbound travel lanes on the outskirts of town has been lit up during the holidays for years. No one seems to know who exactly maintains the cactus lights. It is lit up before Christmas every year and stays lit throughout the new year, running on solar power. People have spotted the man who decorates the monument, and there are legends of why the cactus is decorated, like for fallen heroes or veterans. News 46 has made calls, created posts on social media with no real concrete answer. As for now, we will enjoy the solemn lighted plant at least until someone comes forward to tell us the real story of how the Pahrump Christmas cactus came to be. If you have any information, contact me, Deanna O'Donnell, at deanna@kpvm.tv. Well, we'll be back in just a moment with your Act of Kindness Award, and I hope somebody comes forward with that cactus, right?
It's really interesting to see it outside the road, so.
We'll be right back.